Did you know that having your first period before the age of 12 or having your first child after a certain age could increase your chances of developing breast cancer? Today, I'm going to share with you 12 simple things that could increase your risk for breast cancer and the steps that you need to take if you think that you may be high risk for breast cancer. If you're new here, welcome to Health Corner. I'm Dr. Shalom T, and I bring to you the information that you never thought you needed so you can make informed health decisions on a daily basis. Don't forget to subscribe, like and share this video. Turn on post notifications so you don't miss out on any other updates. Let's get right into it. The first thing is menstruating at an early age. So if your period came before the age of 12, this could actually increase your risk of developing breast cancer. Why? Because some studies have shown that being exposed to higher levels of estrogen, progesterone for longer periods of time can increase your risk for breast cancer. The second thing is late menopause. Normally, menopause in women can start from ages 45 to 55. But if you get into menopause after the age of 55, this could as well increase your risk for breast cancer. Why? Because you've been exposed to these hormones for a longer period of time. Another thing is if you had your first child after the age of 35, if you've never breastfed, if you've never had a biological baby, if you're also experiencing nipple discharge, it could be bloody, it could be watery. However, the discharge is if you're not breastfeeding, because if you're breastfeeding, then that's normal. But if you're not breastfeeding and you're experiencing nipple discharge, this could increase your risk for breast cancer. Another thing is advanced age in women. Unfortunately, this is just a normal phenomenon. There's nothing we can do about it. But once you start to get to the age of 40 and above, you want to pay more attention because your risk for breast cancer naturally increases. So you want to take your screening measures more seriously, whatever you can do to early diagnose breast cancer if it starts to develop. Another thing is if you're exposed to high levels of radiation. It could be radiation from cancer therapy, it could be radiation from X-rays, whatever form of radiation could increase your risk for breast cancer. We also have some lifestyle factors that could increase your risk for breast cancer, like alcohol consumption. If you drink more than 2 cups of alcohol in a day, this could drastically increase your risk. If you're a chronic smoker, if you're physically inactive, if you're obese, or if you like foods that are high in fat, this can increase your risk for breast cancer. Another thing, and this is really important, is family history. So if you have a first-degree relative in your family, like your mom, your sister, or your daughter who has breast cancer, it really increases your risk of developing breast cancer. Also, if there is inherited genetic mutation in this gene called BRCA1 or BRCA2, it can really increase your chances of developing breast cancer. In fact, there is a 45 to 85% chance for you to develop breast cancer if you have this mutation in your family. So pay attention to that. Another thing is if you've previously had cancer, especially breast cancer in one of your breasts, the probability of you developing cancer in the other breast is really high. If you've also had ovarian cancer, endometrial cancer, colon cancer, all of these could really increase your risk of developing breast cancer in the future. Lastly, being on hormone replacement therapy to alleviate some of the symptoms that come with menopause could actually increase your risk for breast cancer. Some studies say this could be protective, other studies say this is, a significant risk factor, but it depends on a lot of factors that I'm not really going to get into right now. But just for general knowledge, know that hormone replacement therapy could increase your risk for breast cancer. If at least 5 of these factors apply to you, or you're over the age of 40, it is time for you to take action. You need to start screening for breast cancer immediately, and here I have some guidelines to help you out. If you're between the age of 20 to 39, you need to do a breast self-examination monthly, and you need to go to the hospital to get a clinical breast exam at least once every year. If you're between the age of 40 to 44, you want to do the breast self-examination monthly, clinical breast exam yearly, and you can start doing a mammography every 1 to 2 years. If you're 45 to 55, you're going to do the same thing. So that is breast self-examination at home, clinical breast self-examination in the hospital by a doctor, and you're going to do a mammography at least once every year, because this is the age where breast cancer can be caught early on. If you're greater than 55, you're still going to do these same things, and you can do a mammography every other year. So that's once every year, once every 2 years or 3 years as you see need. The purpose of this knowledge is not to scare you. It's simply to educate and build awareness so you can be more intentional about doing your breast self-examination at home so that breast cancer can be detected earlier on. If you haven't watched the video where I explain how to do the breast self-examination at home, you may want to go and watch that video. I'll have it linked right on here on the screen, or I'll put it in the description box so you can go check it out. Thank you so much. I'll see you in my next episode. Bye-bye.